Feeling and being sick if you have pancreatic cancer. Feeling sick, also called nausea, and being sick or vomiting are very common if you have pancreatic cancer. I'm Jenny, and I'm one of the specialist nurses at Pancreatic Cancer UK, and in this video I will explain what can cause sickness and what can help. Feeling and being sick is unpleasant and distressing, and it may also mean that you are not properly absorbing the medicines that you take. For example, pancreatic enzyme replacement therapy, or PERT for short, for digestion problems, and painkillers. What causes sickness? There are a few things that can cause sickness for people with pancreatic cancer. Some treatments for pancreatic cancer can cause sickness. For example, chemotherapy can make some people feel or be sick. This usually happens a few hours after treatment and can last for a few days. You will normally be given anti-sickness medicines to manage this.
When I started having chemo, I generally found myself in a situation whereby with the medication, the anti-nausea pills, that the nausea was controlled. So that made life a lot more pleasant.
Some medicines, such as antibiotics and opioid painkillers, for example morphine, can make you feel sick. It is still important that you take these as prescribed. Your doctor can advise you on what to do if you are feeling sick, and they may also give you anti-sickness medicines. Feeling anxious or distressed can make you feel sick. Speak to your doctor or nurse if you are feeling anxious. Pancreatic cancer can cause problems with digesting food, which can make you feel sick. PERT can treat some digestion problems, which should help with the sickness. The cancer itself can also cause sickness. It can block your duodenum, which is the first part of your small intestine. This can stop food passing out of the stomach into the duodenum and can make you feel and be sick. The cancer can also block your bile duct, and this can cause jaundice, which can also make you feel and be sick. These blockages may be treated with stents or sometimes with surgery to bypass the blockage. Find out more about stents and bypass surgery on our website at pancreaticcancer.org.uk/sickness. Speak to your doctor about the best treatment for you. Persistent vomiting. Persistent vomiting is when you are sick a lot and struggle to keep any food or fluid down. This can be a sign that something is wrong. Contact your GP or medical team if you've been vomiting for half a day or longer and can't keep any food or fluid down. What can help with feeling and being sick? There are ways to manage feeling and being sick if you have pancreatic cancer. There are lots of different anti-sickness medicines that can help. It helps to take the medicine as prescribed and as soon as you are given them. Don't wait until you feel sick. If the medicines don't help, speak to your doctor about changing to another one.
After the first round of chemo, the nausea was quite shocking. It was quite life debilitating. You just feel like you can't move because you're in fear of vomiting, and nobody wants to do that really in front of people. But the conversation needs to be had because they do give you medication to take for the sickness. And for me, the first medication just wasn't right. And having that conversation on the second round, I was given a different medication, and that made life a lot easier. And I also found taking it quite frequently, not just waiting to feel nausea and then taking it, or maybe only taking it once a day. You need to take it regular and wait for the couple of days to pass through the chemo and then reduce down, and then everything was just so much easier then.
Can anything else help with sickness? Some people find other things can help them deal with sickness. Your sickness may be worse if you have an empty stomach, so try eating little and often rather than 3 big meals a day.
So to help with the nausea and vomiting, I would eat little and often. I would sip water rather than drinking a whole glass at a time, because I think when it hits the empty stomach, it sort of can make you feel more nauseous. I also found that spicy food would help with my nausea and vomiting, and I'm not saying that it will help everybody, but for me it did, and also drinking some Coke.
Ask someone else to do the cooking if the smell makes you feel sick.
The things that made me feel worse with the nausea was definitely getting too warm, the kitchen with the cooking smells, things like that. Quite quickly though, you learn to what it is the trigger and what you need to remove. Chemicals too strong of perfumes, things like that.
Some food and drinks can help. Try foods or drinks containing ginger or peppermint.
I have found my own kind of remedies for nausea. I like ginger, for instance, either the gari, which is the sushi type ginger, which gives pickles, or ginger beer. You know, high quality ginger beer. There's an Australian brand that I like, and somehow ginger has an effect on settling the stomach.
Keep your mouth clean. After being sick, rinse your mouth with water and wait for about 30 minutes before brushing your teeth. Stomach acid can weaken tooth enamel, and brushing straight away makes this worse. Eat meals slowly and try to sit up for an hour afterwards. Tell your medical team if you have white spots in your mouth. This could be oral thrush, which can make sickness worse. It can be treated easily. If you are feeling or being sick, speak to your doctor or nurse about what might help. You may also find it helpful to speak to us on our support line. We are all specialist nurses, and we can talk with you about sickness and answer any questions you have.
For more information and support, visit pancreaticcancer.org.uk. You can contact our free support line on 0808 801 0707 or email nurse@pancreaticcancer.org.uk.